Ladies and gentlemen, welcome to our discussion on the art of taping in sports and rehabilitation. As we begin, let's start with the basics. Taping is a form of strapping that uses tape attached to the skin to physically keep in place muscle or bone at a certain position, reducing pain and aiding recovery. It's a partial immobilization of a joint, allowing for a certain level of functional mobility. This technique is used for various purposes, including the prevention or recurrence of injury, supporting ligaments, tendons, and muscles to protect against further injury, limiting excessive or unwanted movement of unstable joints, and protecting and supporting injured structures in a functional position. Taping also enhances proprioception, which is the perception of the position and movement of one's body, and kinesthesia, which is the awareness of body movement. When applying tape, it's essential to consider several factors, including how the injury occurred, what structures were damaged, what tissues need protection and support, what movements must be restricted, and whether the injury is acute or chronic. It's also crucial to be familiar with the anatomy and biomechanics of the parts involved and to have a good understanding of the taping technique. Now, let's talk about the benefits of taping. Taping can reduce pain by alleviating pressure on the skin, neural, and sensory receptors. It can also reduce swelling by increasing fluid movement, and can speed up lymphatic drainage and flow by increasing the amount of space beneath the skin. Additionally, taping can relieve muscle pain, increase range of motion, and normalize the length-tension ratio to create optimal force, assisting with tissue recovery and reducing fatigue. There are various types of tape, including non-elastic tape, elastic tape, and kinesiology tape. Non-elastic tape is made of cotton with zinc oxide adhesive mass, is hypoallergenic, and is available in various sizes and colors. Elastic tape, on the other hand, is commonly referred to as stretch tape, gives good conformability to body contours, and is made of twisted cotton and adhesive backing. Kinesiology tape is a type of elastic tape that mimics the qualities of human skin, works by subcutaneously lifting the skin, and can enhance muscular, joint, and circulatory function. When applying tape, it's essential to follow specific guidelines. First, the skin should be washed and dried, and any oils or lotions should be removed. The athlete's skin should be checked for any allergies or hypersensitivity, and under wrap should be applied to sensitive skin. Broken lesions should be covered, and protective padding should be applied to friction and pressure areas. The position of the joint is also crucial when applying tape. When using non-elastic tape, the joint should be in a range of motion that will be stabilized, with minimal stress on the injured structure. When using elastic tape, the position of the joint will vary due to the stretch quality of the tape. There are also specific techniques to follow when applying tape. The first strip of tape should be applied above and below the injury site, where subsequent anchor tapes are attached. Support strips restrict unwanted sideways movement, while horizontal strips add stability to the joint. Vertical strips provide stability, and reinforcing strips add tensile strength. However, there are also potential complications to be aware of when using tape. Reduced circulation from taping can occur, as well as irritation due to mechanical or allergic phenomena. The effectiveness of the tape can also decrease over time, and it may cause blisters and lacerations. In conclusion, taping is a valuable tool in sports and rehabilitation, offering various benefits and techniques to aid in injury prevention and recovery. By understanding the basics of taping, the different types of tape, and the guidelines for application, we can effectively